Epidemiology seminar series. I'm Angela Lee Nguyen, an assistant professor in Department of Epidemiology at Colorado School of Public Health. Today we have Dr. Jimi Adams as our speaker. We're truly excited to have him give us his talk on limitations of modeling multiplex diffusion with uniplex network data. Dr. Adams is an associate professor of health and behavioral sciences at the CU Denver. He has a PhD in sociology and was a Robert Wood Johnson Foundation's Health and Society Scholar. His research areas involve addressing how networks constrain or promote the diffusion of information and their diseases, and using social network theory to improve strategies used in the design and implementation of primary data collection projects. Today's seminar will be recorded and posted. So please put your questions in the chat box and we'll monitor them and have a Q&A with Dr. Adams after his talk. So without further ado, please welcome Dr. Adams.
Well, thank you. I'll just add that if there are questions that come up that are better to address kind of along the way, I'm happy to do that as well. We can hold them, but if there are things that need clarifying or what have you, feel free to let me know. This project kind of puts together more or less the kind of two primary research interests that Dr. Lee Nguyen just mentioned of mine, kind of networks as kind of substrates for the understanding of the processes of diffusion and how data collection kind of factors into what we can do with that. This is work that's joint with a PhD student in applied math at CU Boulder, Nicholas Landry, and I'd say probably at this point it's more or less kind of equally contributed work. Since I don't really know a good number of you here, I thought it would be useful also to kind of put this particular project in context with the other things I do. I kind of have three, at this point I'd describe it as kind of three major bins that my work fits into. The first is work on the structure and or the organization and kind of temporal change in that structure of interdisciplinary fields. This is joint work with Ryan Light, who's at the University of Oregon. And our real interest here is thinking about kind of the catalysts and barriers to how science that involves many disciplines operates. This is currently a book that is under contract with the University of Columbia Press that we're working on. It was supposed to be my sabbatical project, but COVID got in the way of that, so it'll be continuing on for the next year. But it's a project that we have a lot of kind of empirical work that started out in studying the field of HIV research, but has expanded to a lot of other case studies as well to make sense of some kind of theoretical ideas about how interdisciplinarity can work versus the way it should work. So that's one. A second, as was mentioned, a primary interest of mine is in the area of kind of network methods. And this has kind of taken two flavors. One is focused on network data collection, the strategies for doing so, and evaluating the quality of data that results from such efforts. And this is probably best exemplified in a book I don't know if you're familiar with the Little Green Book series, but the Little Green Books that SAGE produces on kind of statistical methods that I published a couple years ago on gathering social network data. And then I'm also really interested in putting kind of network data together with other types of complex data structures. One type of work in this vein has been looking at how network and spatial analytic strategies meld well together. And there's a variety of other things I've done in this vein as well. Then the third, and probably actually, if I were telling this story chronologically, the first interest in my work in networks was really in epidemic modeling and diffusion processes. I started out studying HIV and other sexually transmitted infections and thinking about how network structure constrains diffusion of diseases through a population. This also then has been applied to COVID-19 with work with folks out at the School of Public Health over the last year. And this is combined work that is kind of modeling empirical data, simulation work, and then kind of various forms of decomposition as well. And then lately, over the last, I'd say kind of 5 or 6 years, actually probably 8 years now, this work has transitioned into focusing not so much on just infectious diseases, but also behaviors and other non-infectious health outcomes and how those spread. And you're going to see examples of both of these a little bit in the talk today. So today is really kind of an application, like I said, of this and the kind of data collection effort, thinking through really the implications of how we go about collecting network data and the design decisions we make in doing so, how those implicate our capacity to model diffusion of various sorts. So let me kind of start with a very simple idea, and that is that networks, like I said briefly earlier, networks provide kind of the substrate or the structure over which things can spread through a population. So this is an example from a friend of mine's work in Malawi, where they were studying sexual partnership networks and how that contributes to our understanding of HIV transmission through the population. And so then we can study the structure of networks to understand properties that lead to why things spread fastly or why they kind of spread slowly through a population. And like one of those kind of structural ideas about networks that we focus on often is what is known as centrality. So centrality basically picks up via a variety of metrics. It picks up the ways we conceptualize kind of who's important in a network. So if we're thinking in disease diffusion terms, we might think that those who are more central are more likely to get infected or more likely to spread a disease to others. It so happens in this particular study, and it's one of the reasons I use it as the example here, that centrality was actually negatively correlated with HIV status in this population. And the reason they discovered, they kind of were able to work out later, was that the network that they actually captured through surveys that were studied over time was happening after the transmission events rather than kind of picking up the transmission events. So what was happening was people who were getting infected were increasingly moving to the periphery of this network. And so that's why we have kind of a negative correlation between centrality and HIV status in this particular population. And that points to kind of one of the concerns that motivates the project today, and that is, how does the way we collect data and then the way we assume we can model those data, how do those things interact with one another? How does kind of the process of data collection potentially impact what we can and can't do in a modeling sense with the data we have? So before I dive in, or kind of along the way here, I'm going to need to introduce a couple concepts that may or may not be familiar. And so just to if they're familiar, bear with me, but if not, hopefully this will help. So networks often are studied in what we refer to as kind of single layers. That is, there's one type of relationship that is captured at a time. But many networks that we're interested in are inherently what we refer to in sociology, they're inherently multiplex. This is referred to in other fields as multi-layer. And that is the same or different ties or different types of relationships can promote the spread of something through the population. So if we're thinking about a sexually transmitted infection, right, you can have both sexual partnerships and needle sharing partnerships that can convey that disease through the population. And so we could have layer 1 here representing sex and layer 2 here representing needle sharing. And we can have the same people in each one of the layers, but different relationships or different ties, the sexual partnerships and the needle sharing partnerships, represented across the separate layers. And that's exactly what I kind of cut my teeth doing in HIV research, as we were studying a data set that you'll hear a little bit more about later that involved both commercial sex workers and people who inject drugs in Colorado Springs, and studied their partnerships over time and how this contributed to STI risk for the entire population. And this is a visualization of some of our work that was published a number of years ago from those data. But like I said, I'll give you a little bit more on these data in a bit, because we're going to use them again in this particular set of analyses. But the basic idea here is the notion that kind of networks that can carry, in this case, diseases through a population often entail multiple types of relationships at the same time. I will probably interchangeably use the term multiplex and multi-layer. That's just disciplinary differences in how we talk about these things. Just to give you some examples of how kind of diffusion processes are often inherently multiplex, I just wanted to show a few kind of fun examples that have come out recently. These are data on, a paper thinking about animal behavior and how You could think about how like diseases could pass between, in this case, birds, right? And they can have different types of relationships here represented by those birds that mate, those that interact socially, and those that interact in kind of spatial closeness. And you can think of each one of these as being different types of behaviors, different ways you would collect data to represent those things, but each one can potentially provide the opportunity for spread of diseases through a population, in this case of birds. Alternatively, this is a very recent paper that I found very, really intriguing. That was published in American Sociological Review that looks at the spread of the Protestant Reformation. And it looks at the spread of the Protestant Reformation as a product of two different types of relationships. One were relationships of Martin Luther's personal communications, who he sent letters to and received letters from, and visited. And there's a number of ways they represent personal relationships, but it's basically looking at kind of Luther's kind of personal contribution to the spread of the Protestant Reformation. And then the kind of what makes it multiplex is they also then looked at the inner city trade routes between various places where Protestant, where the kind of Reformation sprung up. And they find kind of effects of both. And I'm forgetting which one's stronger at the moment, but I think it was actually the trade routes were the stronger influence on the spread of these new ideas. And so, kind of the next thing I want to mention when we think about multiplex networks is that often the way we go about collecting data is not multiplex. What I mean is, instead of, if we're studying the diffusion of ideas across online social network systems, instead of getting information about Twitter and Facebook and TikTok and all of these kind of platforms simultaneously, often what happens is we scrape data from one of these at a time, and we ask the question of how does, an idea or a meme or what have you spread across that platform. But what that doesn't capture is the fact that we often use different platforms in different ways. And so I might learn about something on one platform, then share it on another, and that misses the way that those different platforms are kind of combining together to provide the diffusion of that idea through the population of interest. And this also happens very often in population health research. So one of the reasons this happens in population health research is we have kind of strong specialization that focuses on kind of the behavioral kind of particularities of certain populations, and we get really good at understanding and studying those populations and getting data from those in particular ways, so that if we're talking about the Colorado Springs data that I still use today, even though it was collected in the late 80s and early 90s, part of the reason I still use these data is it's a data set that puts together needle sharing and sexual partnership relationships in a single data set that allows you to identify populations, that allows you to identify the individual members across those layers in ways that data sets that only study one of those at a time can't do, right? So I'm involved in multiple projects right now that are collecting data either on people who inject drugs or people who are at high risk for contracting STIs through various kind of sexual partnering behaviors, but those two things are kept separate in a lot of those projects. And so the question here really is, how does modeling a diffusion process that is fundamentally multiplex in nature on uniplex data, or data that only has one layer at a time, how do those kind of uniplex diffusion models misestimate their contributions to multiplex diffusion processes? So in general, what we're going to do here is we're going to estimate a classic diffusion curve, or an S curve is how these are often referred to. It's just a prevalence curve over time. And we're going to ask over time, what's the proportion of a population that has adopted a new idea or adopted a new behavior or become infected with a disease. And we're going to do this first for the multiplex network. So we're going to ask how rapidly does something spread through that multiplex network. And then we're going to decompose those networks into their constituent layers and re-estimate those S curves. So you could think of the kind of red and the blue lines here as essentially being kind of relationship type 1 or relationship type 2. That can be like sex and needle sharing, or Twitter and Foursquare is what we're going to have later, right? And we can ask kind of how each one of those constituent layers, what their diffusion curves look like. And then we can put those two things together in a union by asking at each time step how many people have become infected across either one of those layers. And we're using a union here, not an addition, because some people might become infected in each layer and we don't want to count them twice. We only want to count an infection once when it happens, regardless of which layer it happens in. Right? So we're going to then compare the union of the constituent single layer diffusion processes to the multiplex. And that is compare the purple and the green lines here and ask how they line up. Okay? And this heuristic version is representative of what my thinking was before we started this project, that was basically that they aren't going to kind of sum up to each other. And you'll see in some ways how that holds and in some ways how that doesn't once we get into some results in a bit. So before we can do this, I need to introduce one more kind of distinction here, and that is that diffusion or contagion processes happen via a variety of mechanisms. And for the purposes of today, I'm only going to talk about two of them. But let's start with what gets referred to as a stochastic contagion process. And you can think of this as kind of representing disease propagation processes. And so what we have here is, let's assume for a moment that this population, I think this is 50 nodes, right? That this population of 50 people, one person is infected at the beginning of the simulation. And we then ask, given some probability of infectivity, so this is saying for every person that is connected to that infected person, they have a 50% probability at each time step of becoming infected. Right? That's what the beta tells us. And so we can simulate this and just watch the diffusion happen through the population. And with infectivity of 0.5, this is going to happen really quickly. It's not going to take many time steps to reach everybody in that, what we refer to as a connected component. Everybody who could be reached is reached by that spreading process. These people out here who aren't connected can't be infected because they don't have a pathway to do so. So we reach the kind of full extent of the infection quite quickly with high infectivity. If we lower the beta, so now this is saying instead of a 50% probability of being infected with each contact at each time step, we lower that to 0.1. What you're going to see is the spreading process, not surprisingly, is going to happen much slower. Oops, I didn't press play. So now every connection only provides a 10% probability of infection at each time step. Ultimately, if we let this run long enough, you're still going to see the entire connected component get infected. It's just going to take about, I think it's like 3 times as long to get there. I think it took 7 or 8 time steps in the 0.5 infectivity probability, and now it's going to take somewhere in the 30s. You're still not going to reach anybody who's not connected, but everybody who is connected is ultimately going to be reached relatively slowly. These are the same networks. They're just pivoted. Sorry, the visualization is just rotated, I think. Some number of degrees, 90 degrees more or less. So this is one type of contagion process that can happen, right? The stochastic version. And like I said, this is thought to kind of represent disease propagation through a population. Alternatively, we can have what are known as threshold diffusion processes. And there's other names for this, but I'm going to refer to these as thresholds. These are things that these are the ways that things like attitudes or behaviors are thought to spread through a population. Now, instead of a constant stochastic probability of transmission, what's going to happen is each person who's susceptible is going to look around and they're going to ask for the people they're connected to, how many of them have already adopted a behavior. And we're going to say that if the number who have already adopted that behavior is above some threshold, then that person is going to adopt. If the number of their partners who have already adopted is below that threshold, then they will not, right? So what's going to happen is this, we're going to start with a threshold of 0.25. So this one person is infected. What we can recognize is that this person right here is going to adopt immediately because half of their partners, this one is and this one has not adopted, half of them have already adopted. So they're going to adopt, and we can watch this kind of cascade through the population. Sorry, my dog is really wants inside, but he'll be okay. So you can watch this spread through the population. It gets to the full extent, again, relatively quickly. because it only takes a quarter of their partners to have adopted for each person to subsequently adopt. If we up that threshold, and now instead of requiring 25% of our partners to have adopted some behavior, we require 50%, we're going to see a really different pattern. We're going to see a really different process emerge here. And that is the same first person will adopt quickly because half of their partners have adopted, and then they get one more, and then that's it. Because there's now nobody else in this population who has at least 50% of their partners who have already adopted. So these are different ways that the diffusion process can kind of cascade through a population, stochastically or via threshold evaluations. So as a result, we're gonna do all those 3 steps I described before, the multiplex diffusion, the decomposition, and then the union of those compared. We're gonna do this separately for stochastic and threshold diffusion conditions. Yeah, I think that's good. So just to give you a little bit of idea of the data I'm using, sorry about my dog. We're using 2 different data sets here that represent these types of networks. So the first is what gets referred to as the Project 90 data from Colorado Springs, and I don't have like a spiffy name for the other. It's one that we found via a paper online that provided their network data as an appendix that we're getting to use here. But what they are, the Colorado Springs, the Project 90 data is a combination of a sample of commercial sex workers and people who inject drugs, and then their sex and needle sharing partners, a total of about 6,000 people. The online multiplex platform is a combination of Foursquare data, people who check in the same location within kind of small windows of time with one another, and Twitter followers. I forget exactly what this population is. It's a set of scientists from somewhere in South Asia. I believe it's in India, but I'm not positive of that. There's a total of about 1,500 users, and I rechecked the paper. It actually doesn't say in the paper. I have that in communication with the author somewhere on where it actually is located, but it's not particularly salient for our purposes. What we're really interested in here is that it's 1,500 people and a combination of their Foursquare co-check-in and Twitter data. On the relationship side, these are quite different. And what I mean by that is in the Project 90 data, each person could nominate via a survey up to 15 partners. And those 15 partners represent 3 different types of ties, who they socialize with, who they inject drugs with, and who they have sex with. And we're here only using the sexual partnership and the needle sharing partnerships. We symmetrize these, and that is, we assume if I say I share drugs, I inject drugs with somebody, that that's not just a kind of, we're going to assume that both partners would perceive that in the same direction. So that's what I mean by symmetrized here. In network measurement literature, some people sometimes evaluate, including myself, we sometimes evaluate the differences in nominations versus the differences in the ties. But here we're just going to assume a tie that is reported by anybody is a tie. And then for the Foursquare, the main difference on the online platform here is that the number of ties is uncapped. They can have any number of partners. So in theory, somebody could have 1,499 partners if there are 1,500 users here. I don't think we see that. I don't remember what the maximum is that we saw. It was high, but nowhere near that high. These data come from really different time periods. The Colorado Springs Project 90 data come from the late 80s and early 90s. They were an annual panel. So there's actually 5 time waves here. We're collapsing them and just using them as though they're a single time wave here. It's not particularly relevant for our interests. For other kind of aims, we want to use these data slightly differently. The multiplex online platform data come from 2016. The Colorado Springs Project 90 data are relatively low density. If I'm remembering correctly, the average number of partners is somewhere in the neighborhood of 5 to 6, even though they could nominate 15. And for the Foursquare data, it's relatively high density in the neighborhood of 20 partners per user. These data are both available online for what it's worth, and we're using the Colorado Springs data for the stochastic example of the online multiplex platform for the threshold example, because those are the types of data over which these processes are thought to work. So just to kind of give you a little more detail on how we do this, for each network, we're going to select a randomly infected seed node, one node. We're going to use that then to complete each run that I'm going to describe here, that person will be the infected seed. We're going to, like I said, estimate the process, the kind of diffusion process over these networks according to either the stochastic or threshold rules, separately for a multiplex network first, then for the decomposed uniplex networks of type 1 and type 2, whether that's sex and needles or Foursquare and Twitter. And then we're going to record the cumulative prevalence for the multiplex network in the union of those uniplex networks. And we're going to repeat those steps 1,000 times for each combination of settings, and we'll record each trace, so all 1,000 curves. We'll only plot a sample of them because otherwise these plots become unreadable. But then we'll also aggregate for each setting combination the average prevalence over the 1,000 runs, and we'll also talk about the final distribution size of the epidemics for each one of these, because there's some interesting patterns that come up in what those averages are comprised of once we get there. So I want to show that as well. And we're going to repeat this whole process for multiple infection levels used for the stochastic, and multiple threshold levels for the threshold process. So get to some results. So this is a single setting. So this is beta equals 0.1. So this is a stochastic probability of 10% of infection on the Colorado Springs Project 90 data. And what you see presented on the x-axis here is time. These are just simulated time steps. So at each time step, a person has a 10% probability of becoming infected if they're connected to somebody who's already infected. And what you see here are 4 curves presented. I want to draw your attention first to the black line. So the black line here is the multiplex network. So this basically shows that on average, by about time step 80 or 85, we're reaching about 30 to 35% of the entire population is becoming infected on average across all those 1,000 runs. And then the sex and the drugs are the blue and the red, much lower. That's because they're smaller, separate constituent parts. But once we put the union of those together, what you see is this green line is that union. This is basically saying that about 19% of the population is becoming infected via either the sex network or the drug network if we put those two together. So the punchline in this particular example for the moment is that the union of the sex and the needle sharing networks only ends up spreading a disease to about half as many people as does the multiplex network that combines both of them at the same time. Right? So you have a vastly underrepresented diffusion process by combining the information we would get from a study on sexual partnerships and a study on needle sharing partnerships than you would get if you had a study that put both of those together at the same time. But these averages are actually comprised of a number of things, and so we want to show a little bit about the distributions. This is a distribution of the uniplex diffusion curves, and what you see is the vast majority of the simulation runs that we have here, almost 2,000. So this is 2,000 of 3,000 because there's 3 different settings. So almost 2,000, or 2/3 of them essentially never take off, right? But some proportion of them reach some larger portion of the population, including a large number, a relatively non-significant number that is much larger than that average that I'm showing you here, right? So this drug sharing network reaches almost kind of 35% of the population, which is larger than the average of any of the curves. So this average is kind of combining a lot of simulations that never reach anybody, and then a variety that reach some kind of non-trivial proportion of the population. If we compare that to the multiplex pattern is really different in that you basically either get no diffusion or reaching the entire the entire giant component, which is almost 60% of the population. Right. So this average of 35% is an average of these mostly null kind of simulation runs and mostly complete simulation runs that you get. Give me just a second. Hopefully, sorry. But the main thing I want to take away from this slide is that the union of the uniplex studies, the uniplex simulations would not kind of add up to the union of the multiplex. I mean, not the union, just the multiplex design. So that's one setting. We then kind of vary the beta levels substantially. And if we reduce those betas below the kind of 0.1 level to some somewhat realistic levels for certain STIs, what you see is essentially we aren't running the simulation long enough to get to equilibrium. We're still in the early stages of the contagion process. And we could let that run longer. There's a variety of reasons. We're just going to present it this way for now. And we can talk about settings in the Q&A if you have questions. But for now, I just want to mention that kind of lower betas lead to kind of much slower contagion that just doesn't yet reach the levels we observe here. If we up that, however, what you see is essentially the same equilibria reached for a variety of beta levels, right? So a little more than doubling, a little more than tripling, and kind of a 50% probability. The levels of contagion reached essentially are the size of the largest component within each one of the layers that are modeled. But what happens is you get there faster with a higher infectivity probability. You can see the curves kind of moving a little bit to the left. So punchline on the stochastic or infectious disease model is that the union of the sex and the needle layers don't kind of add up to the diffusion that would take place on the multiplex layer. What happens on the threshold model? Well, it actually kind of flips for most of the settings. I'll get to some differences in a second. But focusing on one level here, so this is a threshold of 0.1. So this is essentially saying, does it have at least 10% of my partners have adopted before I will adopt? What you see happening here is, let's start with the black multiplex line. About 20 to 25% of the population will adopt something in this population if we let the simulation run long enough, and this is far enough to get an equilibrium. However, if we look at only the Twitter or only the Foursquare network, what happens is you end up with more people adopting than is the case in the multiplex network, and the union is even more of that, even more than either one of them. So in this case, the union of the threshold approach leads to a wider spread than is true in the multiplex network, which is kind of, in a number of ways, for our question, the inverse of the findings from the stochastic process. And the distributions here really kind of mimic one another rather than them being kind of compositely very different in the case of the stochastic network example. Just to talk briefly about kind of varying that threshold here, we can both lower it and we can raise it. And in this particular population, it's a little harder to see what's going on here, but the main thing I want to take away from this is if we raise that threshold much at all, you essentially get no diffusion in this population. It's because the network is so dense, it doesn't go very far. We're spending some time focusing around this kind of 0.1 threshold to see where these kind of inflection points arise from, and kind of where the kind of diffusion process takes off and where it plateaus, and at what speed with what thresholds. But the main point here is that the pattern, if I zoom in on these, and I will in the next slide, you'd see that the kind of overall pattern of the green being above the red and the blue and the black, or the union being above the multiplex holds for these higher levels. It's just spreading to a much lower proportion of the population. However, if we look at this, the lowest threshold, essentially, if any of my partners have already adopted something, will I adopt? This is the only setting at which you get a different pattern, and this is the setting at which multiplex is leading to a wider diffusion than in either of the constituent or their union parts. And so this is one where the threshold leads to a difference in pattern. For most of the levels that are kind of meaningful in this population, in other words, needing more than one partner, essentially, you get this pattern that we have on the 10% side that looks like this where the union is greater than the multiplex, but at the base level, at the kind of extreme, only requiring a small amount of one of my partners to have adopted is the only place you get a reversal of that pattern. So the main takeaway here is that the stochastic and the threshold processes kind of lead to different results in how the union of two uniplex processes can be informing the true kind of multiplex nature of the diffusion. This is just kind of zooming in on those previous ones a little bit. I planned to talk about this too, but I think I'll skip it in the interest of leaving time for Q&A. I think we got the main takeaway here, hopefully. So we're in the process of trying to think through some ways to just kind of do some robustness checks or kind of confirm that we don't think that these results are the kind of that they arise from particular kind of unique things about the data we have or the way we've gone about studying it. So what we're doing, one approach that we're in the process of doing is essentially, rather than studying a single network at a time, we want to study kind of a family of networks with similar properties. And so the way we're doing this is fitting what is known as an exponential random graph model to each observed network that basically says, what are the structural properties of that network that allow us then to generate a collection of simulated networks that conform to that ergom. So they're all networks that are similar to the empirical network we have in terms of their structural characteristics, but they're not the exact same instantiation of that network that we have from the observed data that we're starting with. And then we're going to repeat the same simulation process over these simulated network ensembles instead of over a single network at a time. That's more complicated than it sounds. Part of the reason that it's in process is figuring out exactly step one is going to take a minute. And another thing that we probably ought to do here is for each of the simulation parameter combinations that we have, currently we're working with a single infected seed. We probably should vary the number of initial seeds. I don't think it's going to change our pattern of findings that much. I think it's just going to speed up the rate at which we get to them for what it's worth. But that is something we'll need to do just to kind of confirm the pattern of results we have here. So what are our main takeaways? The first and foremost is that multiplex diffusion processes are in some ways misrepresented by models that include only the uniplex diffusion, even if the uniplex diffusion includes both of the constituent networks that compose that multiplex diffusion process. And in particular, the uniplex sex and drug networks, when we combine them, are underrepresenting the diffusion that would take place on the multiplex network representing sex and drugs together. And the uniplex Twitter and Foursquare networks are overrepresenting the diffusion process that would result from the multiplex Twitter and Foursquare network if we put them together. And what's particularly interesting about this is that even the contributions of particular tie types in these processes are going to be misaccounted for in their constituent networks. So if we have this little 4-person network and solid lines are, let's say, sex ties and dashed lines are, let's say, drug ties or needle sharing ties, then if person 1 is currently infected, person 4 can become infected in the multiplex network via a sexual partnership, but they can't, the kind of indirect transmission of that pathogen through the population can't get there without traversing a needle sharing partnership amongst their partners. And so the importance of sex ties for 1 to spread something and for 4 to get something are there, but they're missed by excluding those drug sharing ties amongst the rest of the population. So it's not just kind of at the population level, but even the individual level, sometimes you're going to misunderstand kind of how these ties matter for disease transmission or disease contracting possibilities by only using their uniplex representations. Probably the useful point here is that the general patterns are robust to varied infection probability betas or adoption thresholds taus, except in the extreme boundary of the threshold model, only one partner needed to adopt something. So I think those are our main punchlines and takeaways. So I'm going to leave it there for hopefully plenty of time for questions and or comments, and you're welcome to email them later if you would like. There's my address, or you can probably find Nicholas online as well. So I'm going to cut off there.
Thank you so much, Dr. Adams, for your talk.